Thank you, Mr. Speaker. I'm before you today to present SB276, a bill necessary to protect the safety of our children and community as our country is experiencing the largest number of measles infections in over a quarter century. SB276 maintains and restores the integrity of medical exemptions to legally required vaccines for school enrollment. SB276 ensures that students who truly need a medical exemption will receive the exemption while keeping those same children safe at school by ensuring that there is community immunity. This bill protects the rights of these children to attend school and ensures Californians have the freedom to go about their community without it being at risk of being infected with serious preventable diseases. There have already been 1,234 cases of measles reported in the United States this year, the most cases since 1992, and since measles was declared eliminated in 2000. There have also been 52 cases of measles here in California, including multiple cases at LAX, many of which involved unvaccinated folks catching measles overseas and returning to California with the disease. And there is an ongoing outbreak in Butte County. As reported in the San Francisco Chronicle, while measles has been brought to California on several occasions this year, unlike other states, California has not suffered a huge outbreak like the measles outbreak that began in Disneyland in 2014, because the legislature took action by passing SB 277 to restore community immunity to neighborhoods in California. SB 277 proved successful in raising the state vaccination rates for each entering kindergarten class to above 95%, enough to begin restoring community immunity. But this protection is being undermined by a handful of unscrupulous physicians who are profiting from putting children at risk and making our schools less safe. SB 277 did not substantially change the granting of medical exemptions by physicians, which expected each child to be evaluated by their actual physician, who regularly cared for them, receiving the exemption and applying the standard of care. Instead, after passage of 277, we witnessed physicians who advertised exemptions for cash on social media and on the internet. Some parents would post that their children's physician refused to grant a child a medical exemption, so they bought one from a distant physician. The results of these fake medical exemptions was a quadrupling of the percentage of medical exemptions in the state and a decline in the state vaccination rate below 95% for the current school year. But more concerning, over 100 schools in California have medical exemption rates at over 10%, with some as high as 50%.
No way. I want to see the receipts.
Meaning students at these schools are at risk for major outbreak and are no longer safe. These schools represent tinder for a disease wildfire that can harm the broader community. California cannot allow a handful of bad physicians to put our children in danger, particularly babies too young to be vaccinated and children who genuinely need a medical exemption. That's why the California Medical Association and the California American Academy of Pediatrics are sponsoring SB 276 with the Parents of Vaccinate California. Physicians are holding themselves and their colleagues accountable to practicing quality care based on science and to keep the public safe. With amendments taken up for this beginning in 2021, SB 276 will require all medical exemptions to be filed at the Department of Health, and physicians will henceforth be required to submit requests for medical exemptions to the State Department of Health. The number of people have worked on these amendments to ensure two things. Those exemptions that'll be identified and looked at are when doctors prescribe over 5 of them a year. Most pediatricians, if you talk to them, might have done 5 medical exemptions in their entire life. So if a doctor is simply handing out medical exemptions, it's an indication that something is wrong. In my hometown of San Diego, one doctor is responsible for over 1/3 of the 500 medical exemption in the school district. She advertised, quite frankly, that you would simply send your medical records to her. She would review them, never see the child, and meet with a whole group of families to write medical exemptions. Ladies and gentlemen, we're not getting between a child and their physician. We're getting between a parent who is out seeking exemptions and a physician willing to write them en masse. And even if that happens, this will still be reviewed by a medical panel. There will be due process opportunity to appeal it. And the only ones that are even reviewable are with those doctors who have written over 5 a year, or at a school that falls below the herd immunity standard.
30 seconds, Ms. Gonzalez.
It's been amended in a way that actually solves the problem we were seeking to solve. And it's clear that we need to ensure that we don't, again, subject ourselves to massive measles outbreak. I respectfully ask for an aye vote.
Thank you, Ms. Gonzalez. Thank you for the thoughtful debate, members. Ms. Gonzalez, you may close.
I'm going to try to address a few of the things that I heard, and I'm sorry, I am not a doctor, but my handwriting appears like one. First, I too am surprised that we're taking up this bill today, so for those who are surprised, that happens. First, vaccines are continually evaluated and monitored through the Vaccine Data Safety group. Dr. Pan?
What the hell did you just say?
And they have been. So it's not as if 50 years ago there was a vaccine put out and we've never monitored the safety of it as well. Again, there are over 100 schools that dipped below the 90% community immunity rate, and one lower than 50. I want to be clear. The medical exemption is considered valid until it's not. So if a child has a medical exemption, no matter what reason, and even if it gets evaluated by the Department of Public Health, that child gets to stay in school all the way through the process, even the appeal process, until it's final. So that's important. So people who are saying that we're going to have a backlog, we don't need to worry about that. The backlog is in favor of the child staying in school. I think that's an important feature. This bill is sponsored by doctors, and it's supported by pediatricians, immunologists, oncologists. They all want this bill. Their organizations want this bill. Yes, you can always find a doctor or two who doesn't, but let's be clear who is sponsoring this legislation. Most doctors want the right thing to be done, and I think that's an important feature to remember. It's also supported by the medical board, and I think that that's important because the medical board knows that they can't individually go seek out doctors who are writing exemptions without parents complaining. The parents are seeking these exemptions, so you're not going to get a complaint, and it's not going to be driven in the same way. As far as the database, I know there was some concern. The Department of Public Health does have a database on HIV-positive patients, on STDs, and on cancer. This isn't something new, so I know there was concern being brought up, like, would we do this on other diseases? Guess what? We do. It's the Department of Public Health. The responsibility is to keep the vast majority of us safe from communicable diseases and to understand more about diseases as they come up. We also have the opioid database as well that I think most people on this floor voted for. The individuals also already share it with their school district. And I would suggest that hopefully they realize that information is also hackable, just like your insurance company's database, just like your doctor's database. So I understand none of us like that idea of our children's medical history being hackable, but it's there, and it's already there. I'm not a doctor, and I'm glad that we have the support of the doctors in the legislature, but I'm a mom. And that's why I have always felt so strongly about this bill. In 2010, we had 10 deaths in California because of whooping cough. 10 babies died. That's agreed by everybody. The doctors, the public health advocates, the autopsies, they died from whooping cough, a preventable disease. I have a personal story that I don't like to talk about because I don't want to bring up my family's medical history, but I'm going to because my daughter actually brought it up on Twitter. You should keep your children off Twitter. And so she brought it up and people started asking questions, almost accusatory. But I have a nephew who has a medical exemption. Now let me explain how this works. I have a nephew that is immunocompromised. He has a litany of problems and has probably spent a quarter of his life at Children's Hospital. We deal with this all the time. His mother would like nothing more than for him to be immunized against every disease, because it seems like he gets every disease.
30 seconds, Ms.
The doctor says no, he cannot have live vaccination, so he can't be immunized against measles or chickenpox. Every time he's not in the hospital, he wants to be at school. But those diseases could kill him. Definitely, he'll end up back in the hospital. These are the children, the truly medically fragile children that we're trying to prevent from getting these diseases, and why it's so important. I know people feel strongly about this, and I know all the opposition is just about loving your children. I have no doubt of that. A lot of us are mama bears. But being a mama bear means protecting those kids who need the protection the most. I respectfully ask for an aye vote on this bill.
Thank you, Ms. Gonzalez. With that, clerk will open the roll. All members vote. Who desire to vote, all members vote or desire to vote. All members vote who desire to vote. Clerk will close the roll, tally the vote, ayes 47, no 17, that measure passes.
You're using your time now, so you're 30 seconds in. You can speak for 2 minutes. No. I do not play, all right? We have rules here. We have rules. All right.
I request unanimous consent to suspend the rules to allow Assemblymember Gonzalez to take up SB276 PAN without reference to file for the purpose of third reading. The bill is currently item number 24 on today's second reading file.
Mr. Floor, for what purpose, sir?
We object for the rule and ask for a roll call.
First, vaccines are continually evaluated and monitored through the Vaccine Data Safety group, Dr. Pan. And